Hi, I'm Kelly Davis. The healthcare environment can be stressful, especially when critical and timely care is vital to your patient's welfare. Your job requires 100% of your attention, and part of this attention should be focused on blood-borne pathogen hazards. Today we will look at what blood-borne pathogens are, how they are spread, what you can do to protect yourself, and what to do if exposed.
Come on!
BBP in your world. Don't risk it.
You know, back when my grandmother was a nurse, if someone would have mentioned a blood-borne pathogen, she wouldn't have had a clue.
Nurse, make sure you draw some blood. I smell a blood-borne pathogen here.
Blood-borne pathogen? I don't smell anything. Today, there are many different blood-borne pathogens, including malaria and syphilis. But in your workplace, the three pathogens of special concern are human immunodeficiency virus, or HIV, hepatitis B virus, or HBV, and hepatitis C virus, or HCV.
Hey, you. Why don't you check the vitals on a viral or something?
These BBPs can be a rude group to deal with.
HIV, HBV, and HCV.
HIV attacks a person's immune system and causes it to break down. The clinical picture of HIV infection differs widely from person to person. A number of people infected remain apparently healthy for many years. An infected person becomes seriously ill when the immune system loses its ability to fight infections. Some infected persons go on to develop AIDS. Hepatitis B virus, or HBV, causes serious liver disease. About 30% of the people infected with hepatitis B have no signs or symptoms. Those with symptoms may experience jaundice, fatigue, abdominal pain, loss of appetite, occasional nausea or vomiting. Most people infected by HBV recover and clear the infection, but about 6% become chronically infected for life. Each year, many people die from chronic liver disease and liver cancer linked to hepatitis B, and a small percentage of those are healthcare workers. Fortunately, the hepatitis B vaccine is very effective at protecting you from getting hepatitis B. The hepatitis C virus causes serious liver disease. This liver disease may present symptoms similar to hepatitis B, but there are important differences between hepatitis B and hepatitis C. While 55 to 85% of people infected with HCV have chronic infections, only about 6% of those infected with HBV are chronically infected. It's important to note that HCV infections are on the rise and cause many more deaths than HBV. The only way to detect either virus is through a blood test. Remember, many people infected with hepatitis B and hepatitis C have no symptoms at all. That includes about a third of those infected with HBV and more than 3/4 of the people infected by HCV. In fact, people who are chronically infected with hepatitis C may have no symptoms for up to 30 years. Yet during that time, the infection may be slowly damaging the liver. Hepatitis C is the leading indicator for liver transplants. Unlike HBV, HCV has no preventative vaccine.
How blood-borne diseases are spread.
HIV, HBV, and HCV aren't as easy to contract as many other viruses. HIV, HBV, and HCV are all transmitted in the same way, through contact with blood or other potentially infectious material, known as OPIM, which includes semen and vaginal secretions, as well as any other fluid or tissue containing visible blood. OPIM also includes cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, amniotic fluid, saliva and dental procedures, and non-intact skin or organs from living or dead humans. In the general population, the most common ways of transmission are through sex with an infected partner or when drug users share needles that are contaminated. In the healthcare setting, transmission is most commonly associated with injuries involving needles or other sharps. A key point to mention here is that you are not automatically infected if you are exposed. HBV carries very little risk if you've been vaccinated and have developed antibodies. You can also be exposed to a blood-borne pathogen if blood or OPIM comes into contact with your broken skin or mucous membranes of your eyes, nose, or mouth. Broken skin includes open cuts, skin abrasions, dermatitis, or even acne. Exposure can happen indirectly if you touch a contaminated object or surface and then transfer the material to your eyes, nose, mouth, or broken skin. In fact, dried HBV has been shown to survive on environmental surfaces at room temperature for up to 1 week. Research shows that safety precautions have reduced the number of exposures on the job. Your exposure control plan details these safety measures. It identifies which employees are covered by the OSHA bloodborne pathogen standard. The exposure control plan describes the potential hazards of each job, what measures will be taken to minimize your risk of exposure, and what procedures to follow if there is an exposure incident. Your plan also includes a method of identifying and evaluating safety devices such as protective sharps.
Reducing your risk.
There are several important ways you can protect yourself from exposure. These include standard precautions, engineering controls, safe work practices, personal protective equipment, housekeeping, and administration of the hepatitis B vaccine. Because you can't always tell who has a bloodborne disease, standard precautions should be used with every patient. This means treating blood, all body fluids, secretions, and excretions except sweat, and non-intact skin as though infected with bloodborne or other pathogens. Standard precautions incorporates features of both universal precautions and body substance isolation practices.
Standard precaution? Engineering controls? All that stuff's for wimps. Just do your job the best you can and nobody's gonna get hurt.
Look, standards and controls are not just arbitrary suggestions. Engineering controls are provided by your employer and are designed to isolate or remove hazards from the workplace. Some examples include autoclaves, sharps disposal containers, and safer medical devices, such as sharps with engineered sharps injury protections and needleless systems. Yet the effectiveness of these engineering controls sometimes depends on what you do.
I don't need anybody telling me how to do my job or perform a task. I know what's best for me.
Well, work practices are what's best for you. Work practices are specific procedures you follow to reduce your exposure to blood or OPIM. When your hands are visibly soiled or contaminated by blood or OPIM, wash them with soap and running water.
The finer art of hand washing. Wet hands. Apply a recommended amount of soap. Rub vigorously for at least 15 seconds over all surfaces of hands and fingers. Rinse thoroughly and dry hands completely with a disposable towel. Use a dry towel to turn off the faucet.
If not visibly soiled, decontaminate hands using an alcohol-based hand rub for routine clinical situations. That includes between patients, after removing gloves, and if hands will be moving from a contaminated body site to a clean body site.
Apply the recommended amount of product to the palm of one hand and rub your hands together, covering all surfaces of your hands and fingers until your hands are dry.
Apply an approved hand lotion to your clean hands as often as necessary to prevent skin breakdown. You should also keep your nail tips shorter than 1/4 inch and never wear artificial nails. Studies show that sharps safety devices may significantly reduce your risk of injury during procedures such as joining IV lines, drawing blood, injecting medications, and suturing during surgery. Use a safe needle device or needleless system for withdrawal of body fluids, accessing a vein or artery, or administering medications or fluids. Also, when available, you should use either a needleless system or a needle with engineered sharps protection for any other procedure requiring needle devices. You should also use non-needle sharps that include engineered sharps protection. When using sharps, always follow effective, safe handling techniques to prevent injury. Never shear, break, bend, or recap contaminated needles or sharps, except in cases when recapping is required by the procedure. In this case, use a resheathing device. Never reuse disposable sharps. Discard contaminated sharps immediately after use in an appropriate, puncture-resistant, color-coded container. Nearly 1/3 of all sharps injuries happen during disposal. This risk can be decreased by placing sharps containers within easy reach and slightly below eye level. Do not allow containers to overfill and never reach into a container of contaminated sharps. Do not pick up contaminated broken glass with your hands. Instead, use a broom and dustpan, forceps, or tongs. Follow safe injection practices. Use aseptic technique to avoid contamination of equipment. Do not administer medications from a syringe to multiple patients, even if the needle or cannula is changed. Use IV bags and other fluid infusion sets for one patient only. Do not administer medications from single-dose vials to multiple patients. Do not use IV solutions as a common source for multiple patients. Report all sharps injuries as directed in your exposure control plan. Your information will be entered into the sharps injury log, where it will be used to judge the effectiveness of current sharps safety devices. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where you are likely to be exposed to blood or OPIM, and never keep food and drink in the places where blood or OPIM are present. Never mouth pipette or mouth suction blood or OPIM. Always minimize splashing, spraying, and spattering when performing procedures involving blood or OPIM. Transport specimens of blood or OPIM in closed, leak-proof containers. Wear gloves and handle carefully. Do not let contaminated equipment touch your skin, mucous membranes, clothing, other patients, visitors, or items in the environment. Make sure reusable equipment is not used on another patient until it has been properly cleaned. Personal protective equipment, or PPE, may include gloves, gowns, lab coats, face shields, masks, eye protection, mouthpieces, resuscitation bags, pocket masks, or other ventilation devices.
Personal protective equipment? You don't really need that.
Yes, you do. Different tasks require different levels of PPE, and you should wear only as much equipment as necessary. Read your exposure control plan for details. Single-use disposable gloves are the most common type of PPE. Use heavy-duty utility gloves for some housekeeping duties. Gloves can be torn or punctured, so cover any hand cuts you may have before being gloved. Gloves should fit snugly over your fingers and be pulled as far over your wrists as possible. Single-use disposable gloves should be worn only once, then thrown away. Always change gloves between each patient. If a glove tears, punctures, leaks, or becomes contaminated, remove it as soon as you can and throw it away. Never reuse disposable gloves. Utility gloves may be cleaned or decontaminated and reused if not damaged, but throw them out if they are. When removing gloves, be careful not to touch the outside, which could be contaminated. You should wear a mask and eye protection or a face shield to protect your eyes, nose, and mouth during activities that may generate splatters of blood or OPIM. Wear a gown if you need to protect your clothing or skin from exposure. Wear a surgical cap or hood and shoe covers or boots when large amounts of blood may be encountered, for instance during surgery or trauma care. Be sure to use PPE when resuscitating a patient. Make sure emergency ventilation devices are available when they're most needed. Make sure PPE fits properly and check it routinely for flaws or damage. Always remove PPE before leaving the work area. Immediately dispose of used PPE or have it laundered or decontaminated according to your facility's policy. Good housekeeping protects you and your coworkers. Clean all blood and fluid spills according to your facility's policy. Keep work surfaces and protective coverings clean. Wear gloves to handle contaminated laundry and be careful to prevent exposure of your clothing and skin. Place in an appropriate container in the area where used. Deposit wet laundry in a leak-resistant container. Trash may contain sharps or other infectious materials, so do not reach into it or push it down with your hands or feet. Instead, gently shake down waste containers. Carry waste bags by the top away from your body. Dispose of blood and other regulated medical waste in appropriately labeled, closable, leak-proof containers.
I hear you with these safety controls and all. But you know, sometimes when you're in the heat of battle, you just don't have time to follow all these controls.
That attitude is not very smart, and it isn't safe at all. As a person who works around the constant possibility of a BBP exposure, you can't afford not to always follow all safety and health controls outlined by your employer. Your contraction of a bloodborne pathogen won't affect just you. It affects your coworkers and loved ones for years to come.
What to do if exposed?
If you are exposed to blood or body fluids, wash the exposed skin area, needle stick site, or cut right away with soap and water. If contaminated material gets in your eyes or mucous membranes, flush them with large amounts of water. Your next step is to report the exposure to the designated person immediately. Act quickly, because for some infections, treatment should start right away.
The 1-minute review drill.
Bloodborne pathogens are disease-causing organisms found in blood. The most concerning in your healthcare setting are HIV, HBV, and HCV. Bloodborne diseases are transmitted by contact with blood or OPIM. However, the infected material must get inside your body to cause infection. To reduce your risk of exposure, use standard precautions, engineering controls, personal protective equipment, safe work practices, including hand hygiene and sharps safety, careful housekeeping, and the hepatitis B vaccine. If you are exposed, wash the area immediately and report the incident right away.
Wrap it up.
Healthcare facilities are high-risk areas for bloodborne pathogen exposures, so take active steps to reduce your exposure and remind others to do the same. In your line of work, caring about your health should go hand in hand with caring about your patients. For Working World, I'm Kelly Davis. Work smart, work safe.